pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Roll call of school board members. Everybody's present, so certainly have a quorum. Before we go to 4.0, I want to lay some ground rules. So this is a special meeting, and per Minnesota state statute, we've got some emails, and when we have a special meeting, it's a one agenda item meeting, and that's the whole reason why we don't have citizens comments, etc. The intent of today's meeting is merely we're not going to have any votes today. We do have a school board meeting this coming Monday. The intent of this meeting is to look at the information that was given to us that we approved several weeks ago at the beginning of the school year for our safe return to school policy. Look at some of the numbers where we are, and also look at any adjustments that we may want to make, may or may not want to make to that safe return to school policy, as well as any of the internal stuff within that policy. So really all today is going to be is, as we said last meeting, is a workshop and a discussion. We do have a couple of our folks that are on our incident command team, and so what we will do within this workshop is, as there's questions for them, please ask them specifically if they need to answer. So with that being said, 4.0 is a discussion of safe return to in-person learning plan and mitigation strategy levels. I don't necessarily know where to start. I know everybody probably has some things they want to say, so my intent was basically to go through the strategy levels 1 through 5, and look if there's anything that we need to chat about. So I'm happy to do so, or if somebody else has a different suggestion, or if the superintendent has a different suggestion.
Well, I think maybe just one thing to start with would be just the latest numbers that are provided.
Please do so.
Christy had put this information together as of yesterday. So the spreadsheet that you can see there, last Friday morning when the incident command team met, we had 40 positive cases to date, and you can see that was provided to you earlier, and there were 24 students that were in quarantine at that time. Since that time, we have had four positive cases in the district, and you can see the information dated through October 19th, 2021. So basically, we had an additional case at the high school, 1 at the middle school, and 2 at South Point. Fortunately, especially like the one at South Point, I know that Christy, they did some extensive contact tracing there, and we were fortunate that there were no students that had to quarantine because they were masked, or it worked. So that was good. But just so you have that information in front of you, and you can see that's through yesterday, so Tuesday, October 19th at the end of the day.
Any questions on the numbers?
And if you have some too, Christy are here this morning, and I know they like to speak into the microphone, so just kidding. But yeah.
So I'll open it up to board members.
How's that compared to last year, Mike?
How are the numbers compared? I'd have to take a look and see at the data. Yeah. Wouldn't be very hard to do though, Matt.
I guess hearing no questions on numbers, why don't we let's just open the safe return to school policy, and let's just go through, and I'm gonna quickly go through each one and see if there's anything that we need to talk about. So number one, we know it's a fluid document. However, it's been fluid to its nature, but I think that's the whole reason why we're here is it's a fluid document to talk about some of the things that may have come to our attention, or even the incident command team's attention. So number one, communication. Anybody want anything to talk about communication? I think our electronic messaging system, district website, social media, etc., is doing what it's supposed to be doing. So any issues on communication? Coordination with state and public health officials.
We're doing a fine job there.
Okay, learning options for students K through 12.
Well, we don't really, I mean, we don't have the staff to go to a distance learning, do we?
We could go to we don't want to go to distance learning. It would just have to be with our current staff. We don't have the separate online providers, you know,
Right.
like a separate, like we did in the previous year.
Right.
Yes.
Right.
Preschool, nothing necessarily changes there. Next one is just grade configurations. Nothing changes there. Classroom placement, that's already been taken care of. That was done in August, daily starting and ending times. That's completed. Student support and services, we've talked quite a bit extensively about that. Mike, maybe since we're at that point, if you can kind of update where we are on finding some of those support services and.
Well, I think
maybe those
that's,
things that we
you know,
advertised.
that's a I mean, that's a continuous effort. You know, we are seeing higher needs probably in all of our buildings for mental health support. And we continue to look for people, and we've hired additional staff this year, but we've seen an increase in the mental health concerns with our students and staffs.
I think one thing to mention there is watching the news last night, and whether you believe the news or not, at least the American Academy of Pediatrics, what did they say? They said it's a national emergency for students and mental health. So I think we certainly get our support as we continue to look at support staff, whether it's counselors, et cetera. So.
How are we doing on applicants? Anybody apply?
Pretty thin. We did have one applicant for social worker position, so we'll start that interview process.
And are we looking for positions in each building?
I think we would, we could possibly add at least 2 or 3 buildings if we could find people.
We consistently get para applications still too.
Yeah, they seem to be
is it just
trickling in,
turnover?
you know, it's consistent, you know, you see the turnover, you know, it's pretty consistent, but we did have some applicants this week. So I know Julie, you had a couple of new hires at New Heights. So
How about teachers support?
as far as,
Are they requesting, like, are we okay doing,
I'd have to check with our mental health team on that.
okay?
All right, prevention and mitigation strategies. I think this is the one really that we want to talk about. And the prevention and mitigation strategies are broke down into the levels 1 through 5. So let's merely go through each bullet point, and then we could talk about it from there.
So Brandon, I'd suggest going to this document
Yep.
here too, right? Yeah, so you have the mitigation strategies on the front, and then on the back side is more descriptive, or on the, you know, the next couple of pages.
So the first one, we can't, you know, we're not going to change that unless anybody has issues with it, but the district, we still got to follow all requirements of the state law. If there are any executive orders, if MDE gives us anything, you know, Department of Human Services and the state high school league. Right now, there is no executive orders out there that I know of, and a lot of the other entities are recommendations, but no actual requirements. So let's jump into this document right here, folks, that has the levels, and let's just go. Let's talk about each level. So level 1, the guidance is it's low community spread. Learning model is in person. Let's talk about face coverings regardless of recommendation status. So pre-K is recommended, K-6 recommended, 7th through 12th is recommended. And then, of course, I'm not going to repeat myself every time, but buses are required because that goes back to the federal law where we have to have our students and staff wearing face coverings on buses. So anybody have any issues with level 1 when it comes to face coverings?
No, we're good.
And so, I mean, level 1 really is just as is. That's normal school. However, we jump into quarantine, isolation, close contact information, and board members, give me some feedback on how you want to talk about this, because I think that it affects every level. So if we want to go through the top part of the face coverings first and then go into quarantine and go down, I need a little bit of feedback. So how do we want to do that?
Well, first off, going back to your numbers here, Mike, sorry to bounce back again, but these are through October 19th. So what do we have currently?
Currently, we have active cases would be 6 active student positive cases on the far right there. And no we've been very fortunate to have no positive staff cases. I mean, throughout the school year, which is basically unheard of in districts that I talk to. So.
I guess from my standpoint, when we come through this and we go face coverings, regardless of vaccination status, and we have levels. What I'd like to do is leave today with those levels. And again, we can call it a fluid document, but I really think that we need to put some type of decision matrix in there or numbers, if you will, or at least have that conversation. So, level 1 is 0 to
Like a threshold?
whatever. Yeah.
Okay.
Of active cases?
Yeah. We did it last year. Last year, we didn't necessarily follow active cases. We followed, what was it, Mike, percentage per 100,000?
Per 10,000.
Per
Yeah, the
10,000.
county number. And that was a recommendation.
Yeah. So, when we were at one point in time, when we came back to school last year, we were still above those numbers, and we stayed in schools. We were above those numbers. So again, I think those need to be, this is just my perception, fluid numbers, but at least we need to have some type of number in there. So not only our parents, but our students actually know when we may be prepared to pivot, et cetera. So let's just jump into level 2 then. So level 2, PK is recommended, K6 is recommended, 7th through 12th is recommended, and bus is required. So basically the only difference there, Mike, is the guidance is just, it's still high community spread. That's the only difference between level 1 and level 2.
Yep.
And then there's a social distance, or are we just
Yeah.
talking about up here?
There are
No,
some changes
here,
down at the
okay.
bottom. Yes.
However you guys want to do it. I'm
Does
just,
it make, does it
I'm
make
just
sense
wanna
to
facilitate.
pinpoint it more by building? So if there's a certain, say, 2% by building, and maybe once you hit that phase, then you maybe go face coverings for a couple of weeks till you get below that number to just, to try and pinpoint it, as we see an increase. That just, again, just throwing out ideas if,
Yeah.
if we see in other districts do that, if it makes it more difficult on our staff. I don't know.
Well, we haven't even seen a 1% with
No,
the
that's,
numbers that we've had for this year, so that's,
and I think I did the math, if you have 450 kids in it, it's like, what is it, nine cases, and we haven't seen that at any school so far.
yeah.
But are you going percentage by school then? If you're gonna.
Oh, not like,
Yes,
not
Yeah,
student
so say
body.
there's
Yeah.
450 kids in one school,
Right.
that would get you to 9, then you maybe do face coverings for a week, maybe you do it by week or 2 weeks, just to try to get that number to go down or keep it flat or reduced. Again, just throwing out ideas.
Yeah,
Yeah.
no, it's good.
That's a good one.
Rather than just have, multiple buildings or things like that. I think we can do the best we can to try and stop the spread in the school. The community spread, which obviously I think regardless, we're in level 2 right now, we have a high community spread. But at least what I'm seeing in the numbers, we are not seeing the community and school or the school spread.
Right, they're not going together,
They're not going together. So
and we can't control what's going on in the community based on people going to work sick or going and doing all of the things, that's community spread part is, it's not a piece that we shouldn't consider, but when we're looking specifically at making choices for our school, then it's a point we need to look at, but not maybe make decisions upon, I think. Based on those numbers not really matching up.
So how many of these, so say you do it that way and now you have students in there in a classroom and they don't have masks on, and are we gonna have to quarantine that whole classroom?
I think that's a whole nother subject, is
Yeah.
the quarantining
Yeah.
part of it. I think it's pretty easy to take the masks off, is what we're gonna do with the quarantine,
Right.
is after that.
Because we
Well-
can't sit and send home costumes to kids. Like, we're not set up for that, and with the teachers, we're not set up with that with the community anymore. There's no more.
well, as long as you have seating charts, you know, you shouldn't have to send home. whole
Well, why do we do this?
classes. Let's just finish here.
Yeah, let's go back into the levels. Let's talk about the levels. And as Matt said, that's our next conversation. So I guess my question to the nursing staff or the medical staff and the COVID team is, you know, per Eric, just his conversation at 2%, we could easily, I don't want to say manage, but that would be something that we could capture those numbers per school. We're already doing that. Yeah, I mean, it wouldn't be hard to change our reporting mechanism. I mean, yeah. Merely, we could take the report that we have right now and we can figure
You
out.
have to
the
push
not
the
on
on
the-
button.
So,
There you go.
I just want to make sure that,
Yeah, we're already reporting per building, so that
Okay.
would not be difficult to do at all.
okay, thank you. More discussion on that. Do we want to talk about a direction like that or actual numbers?
Well, when we're talking numbers, if we were sitting here back in September when we first decided to do this, I would have never thought we'd be in the red at 6 positive cases. That's what I'm trying to say.
Right.
I think we are an outlier too. So I think we need to recognize that we're probably one of the few schools that are seeing numbers this low. So I don't want to completely, you know, put our shields down, but I think if we put something in there that to set expectations for the community of where we go and try and pinpoint it, and, you know, I don't want to also have, you know, partial classrooms masked. You know, I think we've got to try to make it easiest on the kids, the parents, teachers, to have a plan in place that is clear.
And easily managed,
Yeah.
because we are an outlier, because our numbers are so low, but
Yeah.
there's reasons for that, right? You know, we've done a lot of things to make sure that our numbers are that low. It's a culmination of factors. But yeah, that's something to recognize for sure.
Last year, our numbers were lower than surrounding communities as well. Like, I don't know. Like, we never really, don't, no?
No,
I guess I don't know that for a fact, yeah.
Yeah, I think.
Oh, yeah, that's right.
Yeah,
Polk
yeah.
Polk County, but I mean like East, like here.
No, I think
County.
Lindsay, before we, when I was the only school board member that was on the incident command team, when we first started, as Soraya said, East Grand Forks was very
Oh, okay.
high compared to all the schools in Polk County. And
Okay.
that was the intent of getting this incident command team and having the support of the administrative staff as well as our nurses, bringing on the other Christie,
Sure.
et cetera, because we needed staff to do that. So
Okay.
I think I firmly agree with everybody. We're doing stuff that's actually working. And we want to continue to do that stuff, but I think we still need to be a little bit rational and figure out as it's working, what are those, what's that threshold or what's that benchmark? I mean, otherwise we say, well, this is going to work and we're just going to do this all year long.
yeah, no,
Well, one thing I want to point out about working is that we're working in the sense of our numbers are low, but when we're talking about needing to increase mental health support in every building, I don't know if we can call it like working.
Sure.
it's fair.
You know, it's a cost. There's a cost.
Yep,
to it.
Soraya, go ahead.
So part of our SEL movement, when we were, and this was before COVID, you know, we had seen in our student surveys at that point a decline in disengagement and mental health. So we were already gearing up for mental health concerns before COVID.
Mhm.
So it was there already, is what I'm trying to say. Do I think the pandemic has exacerbated that? Yeah, I do. But we were in the forefront of that, and I think we still are. And I think with the work we're doing with Jennifer Modine and, you know, working with staff, working with students, increasing that mental health team, we are ahead of the game. So I am glad that we were out in front of this, and we didn't know the pandemic was coming. So I think that's something to celebrate.
Can I ask one question? How are
Yep.
we ahead of the game?
So I think we're doing work with staff right now around adult SEL. So they're learning how to take care of themselves. They're learning self-awareness. They're learning social awareness. They're working on all those key elements that trickles into the classroom to help them when they're working with students who are having needs. And that's across the district. So that's from the front office to the nursing staff, to the paraprofessionals. Everybody's on board with this piece. So it's not just isolated to the classroom. You know, bus drivers have been trained in this. I mean, we're working on this as a whole organization. So the mental health component, I feel like we are on it. I mean, I'm just being honest. I feel like we are moving in the right direction there. And it's going to take time to get everybody where we need to be to give kids that total support. But we got to work on the adults first to get them what they need to be able to, so their cup's full so they can fill the kids' cups. So, we're just in this transition, but we're in this movement. Many districts aren't even in this movement right now. We are. So I feel we're ahead of the game here.
Okay. Thank you.
Thanks,
Yep.
Rheta. Mike, did you have a comment or?
Nope.
Okay. All right, so back to levels. Well, like I said, we're not voting on anything today. We merely have a team here that's gonna have to look at it and put it together. I certainly like the idea of percentages as I read through this. My question for, I guess, the administrative staff is, I already asked the nursing staff that question, but for the administrative staff, let's just say merely for discussion point, we talk about, level 1, 0 to 2%. Level 2 is 2% to whatever, throw out another number, 2 to 4%, 2 to 5% per school. Is that going to become a problem if we manage per school, Mike or administrators?
I don't think it's difficult to manage per school.
Per school or even per classroom if need be.
I mean, we kind of manage that now per school. We have
Okay.
different sets of criteria. I
Okay.
mean, New Heights and South Point would be similar. Most of the middle school and the high school are similar.
Okay.
So
So the difference could be that we could end up with our high school and our middle school masked entirely as well. Like, is that gonna be something that is, how is that gonna go for the community? Are we gonna get as much pushback there? You know what I'm
Well,
saying?
yeah, you could, but I mean, if we were there, that means we're way
Right.
way up. I mean, I think the community itself, as well as our students and our staff, you would have to think that they would accept that if we're up in these level 4s or level, certainly.
No,
don't
I
wanna
know,
be-
I'm just making.
Certainly
I'm
don't want to
just-
be in level 5, but
No, absolutely not. I'm just saying that this changes things from being masked from our K-6 to potentially. the
I
other
see
grade.
what
You know what
you're
I'm
saying.
saying?
Yep.
You're changing that from isolating or, focusing on the littles to everybody, even playing field essentially.
How many kids are in senior high, Brian?
560.
I went to Hillsborough, so give me a little time to do that.
So roughly that 2% would be, yeah,
I'm good.
you good?
I just wanted to make that.
I'm doing math.
Because I think part of trying, obviously we want to keep the numbers low, but to just keep staff and students, to make sure that we don't have that transmission between or student to student or student to staff or back and forth. Just I think everybody knows we're struggling to find staff and backup staff. So by targeting by school, I think that maybe helps that regard too.
Hey, do you want to keep going with your numbers?
Yeah, absolutely. I think, like I said, my intent is to, is this group to come up with at least some ideas that can go back to staff and staff can put it back together and bring it to us on Monday. And maybe a report on Monday, if you will. There's no.
I think it'd be important, maybe, because of the MEA break, the incident command team probably isn't going to get together on Friday. But if we could get together Monday morning to discuss a potential plan, I think it'd be beneficial. So
So do we want to have the incident command team look at percentages? Classroom, school, et cetera, or what's everybody's thoughts? Percentages, numbers, keep it how it is? You know, I
I think
think,
those are just all things to consider before Monday too. Think about it over the next 5 days and
I think merely
be ready to make a decision on Monday.
to keep it how it is. I mean,
I think we have to change something.
yeah, to keep it how it is right now is that's where the rationality I think is missing, if you will. It's a catch-22. Is it doing its job? Absolutely. But we don't necessarily know, okay, when are we going to this level? When are we going back to this level? And I think that's where not only us as board members would like to see at least some guidance. Certainly the feedback that we've received from community members is they at least like to see something along those lines. So
But if we don't take them off when we have 6, consistently right around 5 cases, when do then are we actually going for 0 before we remove that? You know what I mean? If we don't make a move when we're seeing 2, 4, 5, 6 cases, pretty consistently low numbers, then we're going for that. It looks like we're going for 0, which is not going to be possible. I mean, we might get pockets of 0, we might get weeks of 0, but to think that we're gonna stay at 0 and that's like our goal is not realistic. I don't think.
So the ask out of this conversation would be, as Mike said, incident command team would meet Monday morning or Monday sometime, whatever works with everybody's schedules. And to hopefully come with a report to the board Monday night on whether it would be numbers to switch within levels or percentages. But as Lindsay stated, the bottom line is to at least have a little bit more definition on when we move from levels. Is everybody in agreement with that?
I would agree.
We're agreed. Learning models, I think everybody continues to speak of it. Our learning model is we by all means want to keep everybody in person, and the only way we're want to go distance is if somebody tells us that we have to go distance, like they did last year. I mean, as far as I think I can speak for the board when I say that is we're not going distance unless we get a piece of paper that says you must go distance. So
Yeah, absolutely.
face coverings on buses, we can't change that. So let's talk about quarantining, et cetera, and maybe come up with or at least have some discussion here. I'm going to leave the table open and board members have at it.
I know it's a separate, we said it's kind of a separate discussion, but I don't think it really is separate just because taking the face covering off, that's easy, but what are we gonna do once that happens? We can't be sending home kids, every other week because one kid's sick or whatnot. So it's a separate discussion, but they go so hand in hand that you can't make one decision without change. You can't change one thing without changing another, is what I think. What that change looks like, I'm not sure yet, but we just can't be sending home classrooms of kids unless there was like a literal outbreak in that classroom. I don't know.
Other board members?
So what are we doing now when there's a positive case in 2nd grade in Mrs. Garvey's class? What are we doing?
Christy and myself will go to the school, call the family, get the details, was it a positive exposure at home? Do they have any idea where that exposure came from? We find out when symptoms started and when they tested, and then we go back, 2 days from symptoms or positive test date, whichever happens. If they have symptoms, we go from there, or asymptomatic, we go from the test date. And then we interview the teacher, take a look at the seating chart. And right now, 2nd grade's mask. So does everyone consistently wear their mask, around this person? If the answer is yes, we take a look at library, music, and they should be masked. So same situation, everyone's masked. So that the classroom should be good because in 2nd grade, they should have their masks on. Lunch is the big issue. They have seating charts. We go there, take a look at where they're sitting, and it's typically 3 feet is what we're using. It's the person across and next to, so 3 people. Fortunately, we've had people sitting just at the end of the table, so 1 person across and 1 person next, or no one across. So we've had low exposure even at lunch, and so we're very fortunate that way. If it's a student that is unable to wear a mask, then, that's another issue. But if it's in the classroom, if that student is typically in the classroom, everyone else should be masked. So again, no issues in the classroom. But if it's in the special education room, typically no one's masked in there. So, and those kids are all over the place sharing, toys and whatnot. So we've had an issue there that we've taken quarantine, typically that whole room, which isn't a lot compared to a normal classroom.
I got it.
That's what we do. And we look at each situation differently. Even the kindergarten class, every situation is
If I
looked
can
at.
jump on to your question there, Matt.
Go right
I
ahead.
have two questions, I
Yep.
guess. But before I'm gonna ask you to explain what you would do is if they weren't masked. But before that, the special ed rooms, we know that there's a lot of students that, number one, they can't wear the mask, et cetera, because of difficulties or what have you. What do we do in those cases? Right, this is merely for right now,
Mhm.
is if somebody has COVID. And my concern is, okay, we put them in quarantine. How do we provide those services to those students if they are, I don't even know, Soraya, help me with my wording. Yeah, I mean, how do you help students like that maybe need one-on-one care, et cetera, and now all of a sudden we say, hey, you're quarantined because Brandon next you had tested positive. Are we running across problems? I guess that's something that I haven't heard about, but as Christy, as you described that's a concern to me.
That'd be a good question for the principals. I know that teachers are to be in contact with families when they are sent home to be quarantined.
So we got a couple principals, Julie.
So
Okay, that's what I was looking for. And just for the public that was watching, one of our principals answered, sometimes those parents aren't able to provide the services that we provide as a school district. So that, I mean, that's of great concern to my.
So in short, they aren't getting what they would get. Well, and
you need to watch the numbers.
Okay,
Ours would Zoom, well, like, if we have a kid in quarantine, all of our teachers are on Google Classroom, and the kids get on Google Classroom, but our special ed teachers have said that they Zoom with kids who are on an IEP. While they're, so they would technically get this, right? That's, how really we talk, if that's, I mean.
Yeah.
Right, absolutely.
right,
Yeah,
Oh,
yeah.
Kids that are being in the classroom with
yeah, ours would have that minutes resource built in, and they would get their minutes resource from the resource.
okay.
The middle school probably falls somewhere in the middle of that.
Thank you for that. And then, Christy, if you could go through the same question that Matt asked you, but
Not
they
masked.
don't have masks on. This is
Okay.
just normal operation.
Right. Well, again, every situation is looked at differently. And every building is handled differently too. So we go into new heights, kindergarten compared to second grade is a lot different. The way the kids act and interact within the classroom. So let's say it's a kindergarten class. Christy and I would go in, talk with the teacher. And I don't know if you've been in a kindergarten class lately. They are all over the place. They do have their own tables. If they would sit there all day, it would be easy. We would do, the 3 feet, but they are all over the place on the floor, having morning meetings or whatever lesson in front of the smart board, right on top of each other. Would it be the whole class? It has been in the past. how we looked at it. You know, this year, I would assume it would be the same way in that kindergarten classroom, but I don't know. Okay, because it hasn't happened this year that they have been unmasked. First grade's a little bit different too. They're a little bit older, are able to sit in their desk, but yet they're still in front of the smart board, having math or whatever. A second grade, they're a little bit older, again, probably in their classroom, more less interaction with people. South Point, we would go there, look, interview the teacher, probably just the 3 feet in that area where their desk is. But again, it depends on the student. Last year, we had a student that didn't sit in the classroom, and this was at South Point, 4th grade, I believe, and was all over, and the teacher did not feel comfortable just having the bubble around that student. And she said he was all, or she was all over the place in, you know, in everyone's face all the time, every day. So we unfortunately quarantined the whole classroom. Okay, so again, it's every situation is looked at different. If it's a student that just sits in the chair at South Point, the desk, it would probably be just that bubble, the 3 feet bubble versus a 6. So it's less than last year. Middle,
The other part of that too is dependent on the activity.
right,
That given day when that exposure happens.
right,
If the teacher's doing a lot of group work that day, there may be
More.
there's a higher risk for exposure that day.
yeah. So maybe not just the bubble, but that group versus, again, the whole class. The middle school and high school are very similar. We would go around to each classroom, look at the seating chart, what activities were done that day. And again, this year's 3 feet versus the 6 feet. So the bubble around them, if they were doing group work that day, we would take a look at that too. And then it's the lunchroom piece. And, you know, all the schools is lunchroom piece too, we have to look at because they're not masked. Well, the situation, we're not masked. So it would be the lunchroom exposure also. Middle school, if they're vaccinated, they don't have to quarantine unless they have symptoms. Same with the high school. High school, we go around to every teacher, look at the activity, who sits by them, vaccinated. Also, they have the option, students have the option at the high school and middle school if they want to wear a mask. We ask the teacher, do they consistently wear a mask? And a lot of times it's yes, especially if they're in sports up at the high school. A lot of the coaches prefer them to wear a mask, and students, if they do, they don't have to quarantine.
So could we implement something like that, what you just said for the young ones? I think that's what Fergus Falls did. It's like, you're not gonna quarantine until
Unless you have symptoms.
you have symptoms.
Instead of tying quarantine to masks and the 3 feet of space, tying quarantine to more of a symptomatic approach. Like you said, middle school and high school don't have to quarantine unless they have symptoms. And
If they're vaccinated, they have to quarantine if they're deemed a close contact, unless if they're vaccinated, they don't have to unless they have symptoms. So you have to add that part in there. If they're vaccinated, they don't need to quarantine unless they have symptoms.
And that's merely following the decision tree, correct?
Yes.
Well, yes,
Yeah.
the other part of their quarantining is. That I think is really important in this discussion.
Just what I won't turn on, but so there's a 14-day timeline for quarantine. Okay, the first day is the day that you were identified you were exposed, okay, to COVID. Usually then there's an incubation period on day 2 and day 3. That's kind of when the virus starts working within the body, okay? And then days 3, 4, and 5, you start shedding the virus. So you contaminate other people with the virus. Okay, then during that time, usually you don't become symptomatic till day 5 or 7. And actually, we've had some up to what day? Day 8?
8 or 9.
8 or 9 have been some. So when you put at risk not quarantining, you put more people at risk, because if you wait till they're symptomatic, they've already been shedding the virus. That's why with this virus of COVID, that's why the quarantine piece was put in place. because they know you start shedding the virus before and contaminating people before you become symptomatic. So the problem with waiting till they're symptomatic to quarantine is that, well, we've already exposed people. So that's the issue. I just want you to be aware of that if you make that decision. Because then at that point, we've exposed more.
It's an issue, but it also potentially could be a what if.
Mm.
I
It
think,
could be
I
if
think
you-
that's,
you know,
that's,
it
that's
could
the
be.
big thing is the what if is all of us are, this is a classroom up here and now I'm a positive. So we're all sitting, we're all next to each other, close proximity, not masked. Now we're gonna send them all home, end up being home for 14, or they can test after 5, right? I think
Right.
Is that
Yeah.
after 5? But nevertheless, they're
But yeah,
they're home for a certain amount of time, taxing parents, et cetera, taxing the kids going back to possibly not necessarily getting the quality education that they get
Right.
when
Missing
when they're in school and or missing activities and nothing
Right.
happens. So,
Right.
I mean, it's a game of, it's a gamble in itself as well. I see where you're coming from, Soraya. I mean, that was originally where everybody was doing this last year, but my concern is, well, now they gave us local control, and not everybody's doing this anymore across the country. Now, I mean, we're here to talk about only our district, but that's a concern to me. Is that what if? I'm not sure I know how to define that.
mhm.
But I
And like what
So-
percentage of kids are getting sick when they're, you know, even last year, we sent home classrooms of kids, like maybe there's 1 or 2, you know, but it's not 10 or 12.
So the girls actually ran this number and we've had we've had 44 positive cases.
Okay.
We've had 13 test positive while they're in quarantine. That's 30%, you guys.
Yeah.
I mean, that's a significant number of kids that have been quarantined that have, you know, been positive. The other whole portion of this, which is different from last year, is the CDC told us, right? And their recommendation still is 6 feet and they both have to be masked. And they're still going home if they're both masked. You know, the one who was sitting next to the one who was masked is still going home. Well, Minnesota did lighten it when they gave us the recommendations, when they came out with the recommendations this past year. They said, okay, well, as long as they're both masked, then just the one who's sick can go home. I mean, for us, that was a big deal. We were so upset last year when we didn't have that in place and North Dakota did. We didn't understand why we couldn't do that last year. That was super frustrating for us when we had to send home kids who were masked, and that was mandated last year. So to us, we feel that was a nice compromise. And the mask is just a source of control of quarantining, to be honest with you. The mask helps us not to have to quarantine as many kids. I mean, they do go, Lindsay, hand in hand. I mean, if you don't have one, you're going to be quarantining more kids. If you have them both, we get to quarantine less kids. I mean, that's the bottom line. The other portion is we know the vaccine is showing, it shows us when you look at, you know, when we say we have no staff who are, you know, having to go home or quarantine because of the vaccination and lower rates of COVID positive, that's working. You know, and then we have our little ones who don't have access to that vaccine. And the Delta variant is twice as infectious, and we have a higher activity in kids. The variant has shown across, you know, from what we're hearing from doctors. So those are all things you have to think about.
thank you guys. And other questions on quarantine, or maybe some things for everybody to talk about?
A couple other things that I think are factors that play into this is we talk about community spread, and then we talk about school spread, and that community spread isn't as significant, and I agree with that. But there still is a variable there that they're bringing it home to grandma, that they're bringing it home to grandpa, you know, that they're bringing it home to those who can't protect themselves. So I do think that's just something we need to think about. And I also want to think about like the psychological safety of the staff. You know, like the staff, they don't have any cases right now, but how are they going to feel if we make these changes?
Well, we could take a survey. See what they, are they feeling unsafe? Are they feeling nervous? Are they feeling scared? Would the elementary teachers rather have their kids see their faces and see their kids' faces, I don't know, because I haven't
Right.
thrown that out to multiple people, but
You gotta hear this story, Lindsay, and I'm gonna let these guys tell it. I'm gonna let Christy tell it, actually, the one from South Point, when you guys were contact tracing this last one, about what the students were actually doing at lunch. Because I think this is interesting to hear.
So Chad and I sat down, Mr. Grassel and I sat down, and we watched 3 days of video at lunch because the classroom was good. They were all masked. And without being told, all the kids around this positive case masked when they weren't eating. And so we did not have to quarantine anyone at lunch without anyone telling them, you need to keep your mask on if you're not eating. I don't know if they felt safer that way or their parents have told them to do that, but that was a unique, like Mr. Grassel and I are like, oh.
how did the kids know that the kid was coughing and
No,
whatever?
no, they just,
No.
no,
It
this
just
was,
happened to be, this is what they were doing at that table where they exposed, where the child who was positive was.
yeah.
Well, isn't that curious? I don't know how you would explain that.
Well, I
to-
think it's probably,
I'm just saying.
you're wearing a mask, you're wearing a mask right now. If you're gonna take a drink of water, you're gonna pull your mask down, you're gonna
Right.
drink your water and put it back up, and maybe they're conditioned to do that. I'd like,
Yeah.
can you slide the mic down to Todd? I wanna pose that question that Lindsay asked to Todd. Todd, I'll put you on the spot and have you speak on behalf of the teachers as the president of the association, but is that something that you think they would be receptive to, is a survey in that nature, or do you think that's just?
No, I think that would be a good idea. I mean, I haven't talked to all of the elementary teachers. I've asked them to send me some stuff, but I've maybe gotten to 30 to 40%, to say, out of that 30 to 40%, they're probably leaning more to no masks because of, just the learning conditions and stuff like that. But that's, but there's, is it a vast majority out of that? No. And there's concern about, some teachers having immunocompromised conditions. And, so I think trying to get the whole staff, and I think, not just using the elementaries, I think we have to, if there's going to be a chance where things are going to happen at the high school and the middle school, so I don't, maybe you have a survey for the elementary, you have a survey for the high school, middle school, so you can see the little bit different data. Because it is a little bit different at the high schools, and like in my room, we're pretty, I don't have very many kids that are within that 3-foot bubble because I have a big enough room. But I know there's some classes that, there's nothing you can do. But my room, just because of the size, I can spread out a little bit more. But I think, finding out from all teachers on their position, is just another data point that we can use.
Yeah, and I think that was the suggestion, is just. survey
Well, just
for
to
another-
find out
another
where people
data-
are,
data
how you're feeling, if we were to make these changes, are you gonna feel unsafe? Are you gonna feel nervous? Are you gonna be worried? If, just to get an idea of how is the staff dealing with and coping with some of the decisions that we are.
A lot of, like talking to people that are vaccinated in our staff, they want to teach without the mask. They know it's a very difficult thing. And, there's, with my wife, I can tell just by her voice when she gets home that she's had a mask on all day.
Mhm.
And so it's, a lot of the teachers got vaccinated so they wouldn't have to wear a mask. I mean, that was
Right.
everything, all the data we looked at last year. My son got vaccinated because, yep, I don't want to wear a mask and I don't want to be quarantined because I want to be in school and I want to do my activities. So I think that's a big part of why some of the people did all that. But I think getting as much input as possible it's never a bad thing.
Thank you, Mr. Schumacher. So other action items on quarantine?
Well, we got a lot to think about.
Um, I think the one caveat that we've done at the beginning of the year, being on the incident command team, was when we didn't have masks, we'd say, you don't quarantine if number one, you're vaccinated. Number two, you've had COVID within that 90 days. And then that comes along with symptoms too, because people potentially do get this when they're have either one of those. And then number three, if they're masked without symptoms. So we have put some caveats into there. So essentially, if we did, I'm just facetiously thinking here, and if we went from level 3 back to level 2, and that was a decision that was made, and we said masks are recommended. Really, we're not, I mean, kids won't have to quarantine if they're wearing their masks, right? Is that?
Yeah, I think, it's still strong.
Do we still, but we're still tying that to like, and I understand everything that you're saying, but I think that you're gonna end up with, you're kind of giving a choice, but not at the same time. Do you know what I mean by that? Like you can wear a mask, but then you have, I don't know, what I'm trying to say is that like, if it's a choice, but it's not really a choice because you can't have your kid home every other week.
Yeah, okay.
Do you know what I mean? So it's not really a choice if you are still gonna follow the quarantine rules as we have them right now.
Matt, do you have something?
Right, yeah, no, that's exactly what she said. So,
So what do we want as action items coming out of quarantine to be talked about? Incident command team will certainly have some action items to talk about.
well, I think we're gonna have to look at it because we're gonna be right back. If we stay a fluid document, which we haven't been real fluid up to date, is if we take the masks off and keep the quarantining the way it is, we're gonna be right back to masks by sending a bunch of kids home, right?
Yeah.
And we're gonna be taxing our staff and our families and our kids by having them home, like missing. And I understand the way that you put that out with the swapping but we can't be sending our kids home in groups like that. I don't know,
But it wouldn't be in groups, right?
but it
wouldn't
would be more work to sit and try and figure out
We do it
who, where.
To do it.
That every time.
But if they're not masked, it's harder, correct?
So Lindsay, you asked about keeping kids home on quarantine if they have symptoms earlier, right? So what would we consider a symptom? We've seen people test positive with a runny nose and just a mild cough or irritated throat. So what is a symptom?
Right. Well, I know, and you look at the
So-
COVID list, it's every single, you can't
Right,
have anything right now without it being considered
right.
possibly
So then
COVID.
how are we going to determine then who would quarantine? What is a symptom? Right?
Right,
'Cause-
well. I don't know, that's why those words are in there, right? A fever over this, a new cough, loss of taste and smell. I don't know.
But again, like a little runny nose and an irritated throat. People are turning positive with that. Oh, well, we just thought it was a cold or their allergies. So what do we, I don't know the answer.
No, I don't either. I
But-
just don't, but I don't think, I don't know.
Well, and how many kids don't get tested just because they're homesick? You know, so these numbers could be.
But
a
we
lot
can't
worse.
control that. That's
No, I
not,
know,
that's
but-
outside of our control of whether people are testing, whether people are considered, like that's, I think that sometimes we're taking a little bit more on than we should. Because that's not something we can't worry about. Unless and I don't want to get to this, I don't want to require a negative test to come back to school. I don't want to test my kid every time they have a stuffy nose in the morning when they wake up. Like that's not really feasible either.
Well, I think a question that we want to keep in mind is what we're doing, is it making it better or is it making it worse? I mean, are we helping things by what's going, or if we kind of look at percentages, is it worth the risk to kind of what can happen? And go that route and see what happens, but it's, you know, as a school, you want to try and protect all entities, and I think that that's something that we've trying to look out for, and it's showing that we're helping, but there's there's, things that we have to deal with too, but it's, I think seeing these numbers and trying to make it better for keeping staff in school, not having to trace kids all over, and it just is, it seems to be working. And how long do we do that? We don't, we're trying to keep kids in school, and I think it's working for the most part.
I got a question going back to, who mentioned something about sports? Was that Brian or was that you, Christie?
I think Brian did. Well,
Brian talked a little bit about, we'll just speak merely for high school, but I would be curious, let's say today, we have no masks, and I'm just looking for thoughts or your perspective. We have no masks. Majority of our students, from the lower grade levels all the way up, are involved in some sort of activity, whether it's a sporting activity, whether it's an outside activity, drama, karate, what have you. Do you feel, and again, just a perspective, this isn't fact. If we did not have masks, do you think, and we recommended it, do you think that they would, most of them would be wearing them and able to keep themselves in those activities? And it's probably, maybe not, you can tell me that, hey, Brandon, that's not a fair question, but.
I think I did say that too, because I said some of the coaches are
Okay, yep.
recommending to their athletes to wear their masks. And I still think they would if they felt their sport was important enough, if they knew they would quarantine if they were a close contact, if they weren't vaccinated.
Okay, maybe sports or.
Yeah, in sports
like
or
Lynn said, drama
drama.
or any of the other
Right,
activities. There's a lot of kids in elementary that have Boy Scouts, Girl Scouts,
Yeah.
et cetera. Again, it's not just sports, it's other activities
right.
besides school. And
And I don't know, and I know high school level, they probably would take, I may be speaking out of turn, but probably take that a little more serious than at a lower level going to wrestle and,
sure.
oh, I should wear a mask. But I know high school level, I see a lot of kids wearing their masks around, and a lot of them are the athletes.
Okay.
I have two things to say. What I like about that is that it's given, it's a choice then, right? It's a it's not on us to tell them to be wearing their masks. It's on their coach or their teammates or the person. And at a higher age level, they have that, kind of responsibility for themselves to make those decisions, what they want to do for their sport, what they want to do, how they want to stay in school, whatnot. Our littles don't always have the words to put towards anything really. So maybe they're having more behavioral issues. Maybe we're seeing more meltdowns at school. Maybe we're seeing, a decrease in learning and reading and all the other things, or joy, even just depression, like our kids not even wanting to go to school. They don't necessarily have the words to say, this is because of the masks. They might say it every day, but it's taking us out of the equation by putting it into their laps and saying, if you don't want to quarantine or you don't want to miss your sport, you wear a mask. I think that we are trying to control too many things. This goes to the parents, this goes to the families. They decide what they want to do with their kids. And that's where I think that we should this is so much time talking about how we're going to control something that isn't really ours to control. CDC has recommendations out there, that everybody had their recommendations out there, but I think we have to give some power back to the families to make decisions what they want to do with their kids.
Might have to see if we can get that to you, Julie, please.
Listening to all the conversations and wondering too, if while you're considering the elementary schools, if you consider teachers a separate entity. So because teachers are vaccinated, or if they are vaccinated, could they be mask free?
Do we keep track of that? Like who's vaccinated and who's not?
I think that's just.
We don't
a
ask,
slope,
but
though.
Right.
Yeah, you can't ask that. It's a slippery slope to be
Right.
requiring. Then we're pretty soon not letting people in if they don't have their vaccination card. I don't want to go that direction either.
I was just more so curious, like if we say, if we break it out and say teachers, you know, if you're vaccinated, you don't have to wear a mask, but we don't even know who those people are. How do you,
They can offer it.
okay, okay.
I just didn't, you know, I was just thinking of, you know, when Todd mentioned that.
No, it's a good thought, Julie. I think
Great
it's
point.
good.
No.
Yeah.
Thank you.
The- Well, aren't you already kind of doing that when
We
you're
already
saying
do
that
that
your
already.
quarantine is based on your vaccination?
If the parent's not willing to give us that information. Or
Well, and we can't control that though. I think that's, you know,
It's all or none.
yeah, we can't, number one, we can't
I
ask,
agree.
and number two, we can't control. So,
And we shouldn't require it.
yeah, and if they choose not to give information like that, it is what it is. I mean, do we, you know, we've gone for an hour. We've have some discussion. There are some action items. I think that hopefully the incident command team, and there's 3 of us up here that are on the incident command team that that we can address on Monday morning or whenever we have a conversation on Monday. And then my intent is to have another conversation and or possibly a vote on Monday, you know, if needed. So we want the action items are certainly to talk about the guidance or the levels that we're in. Talk about quarantine. Is there anything else?
I was just gonna say, I mean, we can just work with the document as it sits right now. I mean, if we're gonna make big sweeping changes to it, I think that probably takes more time, discussions and surveys and things of that nature, so. You know, something
Yeah,
can.
maybe we won't have a decision on Monday. I'd like one. but-
Well, I mean, we could move within level 3 to level 2.
Right.
That could be a decision without having to.
Yeah,
change.
so what you're saying is, hey, it doesn't mean that this document is, you know, null and void. This is the document.
This is the
now that-
document as it sits
Now that
today.
it's fluid.
Yeah,
don't
if we want to make
necessarily-
changes, I think we probably need to do some staff surveys, things of that, nature. Make sure that if we make these changes, staff will still feel safe and things, you know, stuff like that, so.
So you're saying take a vote on Monday as to this particular document that's out there right now, whether we're going to 3.
I'm
to
just
2
throwing
or
it out
not?
there that we can
Right.
still work with this document
Right.
today. And if we want to make big, larger changes to it, that maybe take more time and thought and discussions, we can consider that too.
And we'll have, if we do have an incident command, we will have an incident command team meeting on Monday. And we should be able to get numbers by then, because numbers do come out tomorrow. You know, pretty much state shut down, our schools are shut down, and I don't, but I would assume that we'll be able to get the numbers for our, you know, zip code, et cetera, to have some data points to look at. So certainly my expectation would be that those will be shared on Monday night as you always do, and we can have conversation from there. Is there anything else within this document, you know, that needs to be talked about, or at least should start moving in the direction of getting talked about?
Well, I mean, like, we can move to level 2, but we do have to examine how we're quarantining. If we're not gonna be masking, if that's not a piece to get kids out of getting sent home, then we have to look at those parameters on what we have set as the quarantine rules.
Lunches and cleanings, all that stuff has been working for the most part. I mean, it sounds like that you've had, nurses have had some issues at lunches, but not as many. And we're still continuing to clean and disinfect, no different than we were last year.
Right. Yeah.
I haven't heard
We
otherwise.
talked about filtration systems. Is that still something that we could?
I know Ron is doing some research
Ron.
on that. He has some information on updated, the ionization.
Yeah,
Yeah.
just some ideas of how else we can improve the quality of health in the school without masking. If we could look into that filtration or that ionization.
Hey, Christie, I got a real quick question. How many, what's on the exempt list for masking? Would asthma be on that exempt list?
now, people that have asthma should wear a mask because they need to protect themselves. But if a person gets a note from a physician, and we take a look at that, and
Okay.
So with something like that, I guess the caveat to that would be, should wear a mask, but also, we know we're just gonna talk about asthma. I mean, there's several different aspects, but that individual also could get something to say, hey, Brandon needs to take a break or something like.
Right,
Would our medical staff, we support stuff along
yes,
those lines.
definitely. And if they're having an exacerbation of their asthma, they shouldn't be wearing it and maybe even be home, but
Okay,
if they're that sick. But no, people that have health conditions should be wearing their mask.
We don't override notes from physicians.
No, no.
and do we expect notes from physicians? I mean, I would imagine that, do you know a majority of our students that have health issues anyway, because their parents disclose that
Right,
at the
right.
beginning of the year, and that's virtually, that's essentially your job is to manage those students as well as
Yep.
the other
Yeah.
students.
And there's very few people that have the exempt.
Okay,
Mike, you've been pretty quiet. You got anything?
Yeah, I have been pretty quiet. I've been listening, taking in all the information. In the end, there are tough decisions to be made. Some things that the masking requirement, I understand that. I mean, it causes problems and it's hard. It has helped. I will say, looking at the numbers, I feel it has helped us. I think that that's going to be a major decision. I think the quarantining piece in other school districts are struggling with this as well. Some people are not quarantining close contacts from school. Some people are only requiring households to quarantine. So you need to take a look at that, how you would go through there. And then you have to have a threshold that if things start to elevate, when are you going to spin it back? Okay, and is it going to be too late? But the other thing that comes into play would be, okay, we have to listen to public health. We have to listen to what they have to say. And we have to listen to our local healthcare providers. And I know that Sarah's working on a report here that's going to come out Friday in communication with some of the local providers. So it's very important to know that. I mean, when we listen to Dr. Wilcox, I mean, I take what he says seriously. He's a medical professional who, I mean, I think we would be foolish not to listen, but it doesn't mean that it controls every decision. But all of those factors come into play. I think that working with the staff, asking them how they feel, when we talk about the masking of staff in our K-5 buildings, when we talk about vaccinations, do we start worrying about discrimination? I mean, there are people bring that up, right? Okay, I mean, if you do it all, then there's no discrimination as far as like who's vaccinated and who's not. Most people are willing to volunteer it, especially if they're deemed a close contact. They're more than willing to volunteer that information. But we've been very careful about, and we want to protect people's rights as well. So there are some major decisions. I would really like to think about this for a day or so and put something together that we can bring to the incident command team on Monday and then eventually to the board.
and then
Okay.
with that, Superintendent Colness, you had mentioned the local healthcare providers. The intent is to try to get something, I mean, that we'll be able to see hopefully on Monday at a board meeting, or.
Yep, I know Sarah, I talked to her yesterday and she said she hoped to have something on Friday.
Okay.
Okay. She's hoping, but I
Anything else on the discussion items? Otherwise, I'm gonna move right to board member comments. So next is board member comments. And really, we've been commenting the whole time. So does anybody have any additional comments?
Do you have any-
I do not have anything.
Lindsay,
No, I think I've spoke a lot, so I think
Matt?
Yeah, I can think of all sorts of them, but we just got very big decision ahead of us and there's very good arguments on all sides of this and we just need to listen to them all. And hopefully Monday we'll have a plan.
Tom?
No, I'm fine, thanks.
Eric, you got anything? All right, well, I appreciate everybody and apologies for the staff and all the other individuals that had to get up early, but sometimes when we have a special meeting, we have to, especially with the half school day, a short week, this was really the only spot that fit in. So thank you for actually interacting with us and answering some questions. So certainly appreciative of that. And I think we have some action items. I saw people writing some things down. Let's take a look at it and we'll come back on Monday. 6.0 is just to let everybody know when the next regular Board of Ed meeting is, and that's this coming Monday at 5:30 PM. With that being said, I'm going to entertain a motion to adjourn.
So move. Second.
Okay. All those in favor of adjourning signify by stating aye.
Aye.
Anybody opposed? Motion carries, meeting adjourned. Thank you to everybody.